urinary bag. Is that okay with you? The client said yes. I'll be back. I'll go and wash my hands and gather my supplies. So I wash my hands, I gather my supplies for the catheter care. I have several washcloths here. I have 2 chucks here. I have several gloves. I have a basin because it's a washing skill, and I have the soap. So I wash my hands, gather my supplies. Hi, you're Mrs. Jones. Hi, Miss Jones, how are you? What is your date of birth? October 4th, 1952. Okay. I'm going to pull the privacy curtain to maintain the patient's privacy and dignity. I am going to lock the bed to maintain safety, and I'm going to raise the bed to working level. Okay, Mrs. Jones, I got the water here, and I'm going to let you check the temperature of the water. You want to check the temperature of the water? Make sure it's not too hot or it's not too cold. She said it's good. So at this time, I am going to put on my gloves, and I am going to place, Mrs. Jones, I am going to place a chuck under you, a barrier to protect your bed linen, so when I'm cleaning your catheter, your tube, your bed linens wouldn't be getting soiled. I'm going to move you closer to me in 3 segments. 1, 2, 3. I'm going to cross your legs, and now I'm going to cross your arms for proper body alignment. Mrs. Jones, I am going to raise the side rail on the left side so you can grab onto it when I turn you on the left side. 1, 2, 3. Mrs. Jones, I'm going to place a protective barrier here to protect your bed linens, okay? One, two, three. Thank you. Mrs. Jones, I'm going to maintain the patient's privacy at all times. But as I'm teaching this class, I'm just going to expose the area so you guys can see exactly what I'm doing with the mannequin. So the patient has a catheter in that is connected to a urinary bag. So what I'm going to do, I'm going to clean her perineal area. I'm going to clean the catheter first, and then I'm going to clean her peri area. So the water temperature is fine. I am using the 4 corners. Guys, we always want to cover a patient, as I said, for proper visualization for the class. I am exposing the perineal area along with the catheter so the students can see. Okay, so I'm going to do the catheter first. So the catheter, you hold at the insertion site of the catheter, and you clean from the insertion site 3 to 4 inches down the catheter. You flip that, you do the same. So this is my soapy water. I'm going to change, I'm going to get some rinsing water, and then I'm going to go back over those sites that I'm cleaning. 1, 2, 3. I'm holding the insertion site of the catheter to protect the catheter from actually dislodging or coming out of the patient. I am going to pat dry the catheter, and now I can get ready to clean the patient's perineal area. From front to back, right? So we go one swipe down, one swipe to the other side, and one swipe in the center. Make sure you hold to the catheter so you don't get it dislodged. Then you can clean the patient groins too. You got one here, and you use the other side to clean the other groin area. So we are going to dry it out, pat dry, and now it's nice and clean. Mrs. Jones, I am just going to
You forgot to rinse.
I am going to get ready to change off the chuck so I can replace a clean chuck under you. Okay, is that okay with you? Okay, so I am going to lower the head of the bed. I'm going to move you in 3 segments. I'm going to pull the side rails up. I'm going to turn you on the side. Hold on to your side rail. I'm going to remove your dirty chuck. I'm going to place this into the trash. I'm going to remove my gloves at this time. So you're going to be rinsing and then drying the upper torso, and then you'll clean one arm. I think she's doing pretty good, right?
Christmas gift.
So she's drying her patient's upper torso, and now she's getting ready to clean the patient's arm. So the arms are long strokes, guys. You clean the cleanest to the dirtiest. The arm, and then the last will be the armpit, right? Mm-hmm. Long strokes.
Side. Other side. 2. And your armpit. 3.
Then the rinsing and then drying. So I think the student completed the anterior aspect of the patient cleaning. So she's going to be doing what, guys?
Back.
She's gonna have to change the gown.
So she need to wash this side to that.
Yes, the entire arm, yeah. Hamper. Can someone bring the dirty hamper closer, please? Roll the barriers from the head.
And then just do the head.
Yeah. dispose of that, both of them in the dirty hamper. So at this point, her gloves are dirty, right? So now she's going to have to change her gloves, wash her hands, and apply new gloves to put on her gown, yes? Okay. So she's following good infection control. She used hand sanitizer, and she's applying her new gloves, and then she's going to change the gown, put on a clean gown. Very good, Sushmita, you're doing an awesome job.
Mrs. Jones, I'll be changing your
So she's putting on a clean gown. So after she finished putting on the clean gown, what should she do next, guys?
I should give her the call bell and
She will place the call bell next to her patient. She will lower the bed for safety, and then she will proceed to the sink to change the water, to get a clean set of water to clean the patient's upper back. Is that correct? Okay. Very good.
Mrs. Jones, here's the call bell. I'll just quickly change the water to rinse off your back, to give you a back rub. And here's the call bell. If you need me anything, you can just ring the bell. I'll be here in a minute.
And lower the bed for safety, and then you can change the water. Very good. She's actually doing the skill very, very good.
Temperature and bed is the working position. So you lower the bed.
So the patient checks the temperature of the water.
Yeah, I'll let him check. Let
Yeah.
him check after cleaning.
So after the patient checks the temperature of the water, what is the next step the student is going to do?
I put
Water-
the bed and working with him.
Water
I need
temperature is
to tell him to
fine.
take that.
Then she's going to be shifting her patient closer to her, right?
Yes.
In 3 segments, closer to her. 1, 2, 3. I'm going to be crossing the legs for proper body alignment and crossing the arms for proper body alignment. Then you will be raising the side rail on the